primary health digital facilitator with the NHS Greater Manchester, leading cross-locality support for the NHS for the Digital First Primary Care Program. His work focuses on helping GP practices adopt and optimize digital tools that improve access, capacity, and patient experience. Jeremy has been a strong advocate for digital inclusion, ensuring that innovations like online consultations, cloud telephony, and NHS app benefit all communities. As an NHS app ambassador, he has designed and delivered outreach events, toolkits, and engagement campaigns that have supported thousands of patients to confidently use the app for appointments, prescriptions, and health records. So we're privileged to have Jeremy here in the company of his dear wife. Can we please appreciate them? Can we please appreciate them? Thank you so very much for coming to the Apostolic Church Manchester. So without wasting time, I'll give Jeremy the floor to do what he knows how to do best. Let's appreciate Jeremy one more time.
Oh, that's very kind. Thank you. Thanks very much. So you need me to speak into this. Is that better? Yeah. Okay. Good afternoon, everybody. I was hoping to open a conversation, really, to get a better understanding of what you know about the NHS app and how you access your general practice services at the moment, and any challenges that you have, any difficulties that you face, and then we could probably walk through some of those. I do have this presentation. It's a little bit linear, and it goes through the typical things that you might expect from a random presentation like related to the NHS app. But I did want to highlight some statistics that we collect as the health team here in Greater Manchester. You can see 3 bars on the screen. It doesn't really matter the numbers particularly if you can't see that. But the bars represent month by month. So we've got June, July, and August statistics here. And you can see the bars go slightly up and down. If you can make that out, it's roughly, there's around 17,000 people each month register for the NHS app, give or take. So we've got about 17,000 in June, a few more in July, and then fewer in August. So the last recorded number there was 16,500 people registering for the NHS app. And what this allows people to do is to access their general practice services for prescriptions, reordering, appointment booking. You want to see your medications or test results and things like that. So those are the main things really that we need from our GP. And what the general practices across Manchester are trying to do is spread the way that we can access that support. So there's 3 main ways that you can access your GP services. If you're not digitally engaged, if you don't have a smartphone and you can't use the app, you can still call the GP and you can still walk into the GP practice. That still exists. So kind of just give you some reassurance that just because digital is there, it doesn't mean it's the only way in. The other thing that GPs are trying to do is offer more services online generally. So if you visit your local GP practice's website, you will see there's different tools connected to access services. They may redirect you to the NHS app for some services, or you might have experience of a different consultation tool, and the name isn't too important, it's just how you interact and put your details in to get that service you need. But they're trying to advocate for a lot more self-help, or if you need to see a nurse for a different kind of booking, you can do that. So they're just trying to separate the ways that we access services because of the high demand and the small number of people in the practice. It's the only way they can manage that and give everybody some level of service and satisfaction to get the health care that they need. Does that kind of make sense so far? So it has transitioned, and when I've listened to people in the community over the last, I think 3 or 4 months at least, especially with the patient participation groups. There's a lot of elder people in them groups who have been around a long time with the practices, and their experience has been that access has become more difficult, and they used to be able to go into the GP practice, sit down in the waiting room and know that whatever number of people were in that waiting room, they knew that was their position in the queue. And it's not the case now. There is so many more people across the UK now than ever before. It's growing still. So we're trying to find a way to manage these pressures and spread the load that makes it manageable for practices. So that's what we're trying to do. So if you can understand that context, it'll allow you to have a little bit more understanding of the challenges that are faced by healthcare generally. So you'll see the extensive waiting lists at the moment because there is such high demand. And there's a lot of economic factors that kind of fold into that as well. But not here to discuss that, but I do want to kind of understand really better how you feel about the current way of accessing services, because it's highly likely that I have some similarities and some similar feelings about it as well. You know, I'm a waiting list too. I try and access services and don't always get the kind of response that I'm expecting. So it's not unfamiliar, but I'm just wondering how your perspective is. If anybody's willing to share any kind of comments or thoughts on that. I did have a good pastor here did share his story initially, which was a positive story, and that's great news. And the narrative is changing more generally. People are saying that they can get appointments. It's just a different kind of appointment. It's for some people, and again, going back to the patient participation group people that I was talking to, it's less personal for them. They feel that they're getting an automatic response, and kind of they feel different about that. They're not used to that. Young people are a little bit more used to text message, things like that, just to kind of say, okay, that's the answer, that's fine. And there's no kind of undue feelings towards receiving information that way either. So it's a difficult balance, but just broadly what I think we need to understand is that the services or access to services, they call it modern general practice access, and it's spread across those three routes to entry. So online, on the phone, or you can walk in. That still exists, all of that. So it's just this online NHS app route is an additional channel choice, and probably one of the better ones to be fair. So there were some statistics, but there's a lot of people across Greater Manchester every month registering for the NHS app. There are other things that I could have showed here, but you'll start crying with all the data. It's just too much. You can download the app. If you were close enough, you might be able to grab the barcode, but if you can't and you know how to use the App Store or Google Play, you'll be able to download it onto your smartphone, things like that. The key features I did briefly mention, but you don't need a lot from your GP, by the way. You generally need to reorder your prescriptions, book an appointment. What else have we got? Not a great deal. Just see your health records, test results. I think there's for those four things are the main things you probably need from your GP generally. You might have some specialist needs in some cases, but generally, those are the top features really that it covers. Anybody got any questions so far? I know you're going to be quiet, aren't you, all the way through this? Okay, I don't know if you're going to be able to see this that clearly, but some of the benefits I did refer to. Some people who are reordering their prescriptions, for example, don't have to go to the GP to drop off their prescription anymore. They can just look at that, order it through the NHS app. So they just check the box to reorder the same medications for their repeat medications. New medications are not on there. It's just for repeats. That makes sense. So the amount of time that's saved, if you can imagine that there's, say, 100 prescriptions a day that's gone into a practice, somebody has to process that prescription. Let's say it takes 2 minutes per prescription. An average practice is probably running 100 prescriptions per day. So 500 prescriptions during the working week, and you can times that times 3. That's 1,500 minutes. It's a lot of time that it takes for practice to do on administrative work. So there's some there's some advantages to the practice that we kind of uptake this approach to reordering prescriptions. That allows the practice to manage their capacity and then get you other services to kind of deal with the face-to-face stuff that's really quite important as well. And we all feel that's being missing out in some cases. Is that the kind of feeling generally? Do people feel like they're getting their appointments? Do they feel like you're getting service that you need? Are you having any troubles? People shaking. There's a mix. Some say yes. There's a mix of that. Okay. Does anybody want to share any barriers that you might have faced? And yeah, please go ahead.
I want to just say that, please, if you have any challenge with any of those things with the NHS app, please be sincere enough to let him know. You know, data counts here so much. What you say, your opinions, your views, those things will be taken into consideration and will be recorded. Yeah? Not now. What you wanted to talk?
Yeah, please go ahead. Yeah.
I get back to the particular doctor, like calling, because if I call the number, there is no assurance I meet the particular, like I talk to the particular doctor I met, so and I'm still expecting the mail from them. So there's no way to reach that particular doctor. So I don't know.
So your experience, if I understand correctly, is you were sent for a scan, you had the results, but you had the consultation with a specific doctor.
So I've been waiting for that, and I can't get in touch with the doctor and call unless I go to the GP.
Okay. So
How do I do that? Like, how do I if I don't want to go to the GP, how do I reach the?
so you want to contact the doctor
That
that
same doctor, yeah.
who was where in the where did you have your scan? Was it the hospital?
Attended to her, referring her to go have a scan. I think the question is that, can she still speak to that same doctor even after the scan or even before the scan? That same doctor.
Okay, that might be slightly different, and that's a little bit more challenging because doctors move around, but your record is usually kept centrally. So whichever system that's been used, so if you went to a hospital for a scan, it will be in their medical system, but the GP should have access. Your GP should be able to request the results, request the access, and all of the notation that comes with that, so that they can relay that to you. If there was something in terms of the therapeutic report that you had developed or felt from that particular GP that saw you, you might just lose that content. You might lose that aspect, that relationship. You felt comfortable. You probably opened out all of your kind of issue, and you probably feel that now, I don't know who, not to not trust, but you've developed something there that has been lost, and I recognise that, I think. Maybe you could take some assurance from the fact that, you know, the information is recorded carefully and it's within the system, and you should be able to speak to your GP in confidence and get the information you need to kind of come back and circle back on that concern that you have. I think all GPs are trained particular standard, but your relationship with the I can understand that's frustrating. Yeah, so it's being described as that you're being moved from one GP to another. So in Manchester, and this is slightly off off topic now. In Manchester, there's something called the Greater Manchester Care Record, and that is a combined oversight record. It's a summary care record of your notes. So you can go to any location in Manchester and your information should be able to be pulled through on this GM Care Record, Greater Manchester Care Record. Okay, they're working on it now. It's in process. But otherwise, results and information can be shared across with your consent as well, by the way, to your GP practice. And it's there where you probably want to try and build that relationship with your GP there so that you can have the same kind of trust that you had for the other GP that you saw. And you don't have to repeat yourself and say the same thing over and over. So I recognise that frustration. I'm sorry you felt that. And I hope you can take some assurance that the information should be accessible for you. Okay. Anybody get any other kind of... Oh, yes, sir.
This is a different question because you mentioned this that records are kept centrally. So I could remember when I first got to this country, registered with one GP. So later I changed their location and I registered with another GP. So to my surprise, because I had an appointment at one hospital, so thereafter they'll be sending any appointment, they'll be sending to my old address. So and I do have the app, which I've done the address, I've updated my address on the app, but to my surprise, they still send any appointment letters or what have you, they still send it to my previous address.
So you just need to update your home address through the general practice that you're with now. Is that what you're saying? You've already done that. Oh, okay. So, yeah. So when you registered with the new GP, you filled in all of the details, all of the form. They took that and put it into the workflow in their system. And then there seems to be a miscommunication back from other services that have your old address for whatever reason. Okay. I think that's a specific thing you probably still need to go back to your GP with so that they can kind of chase the channels of where they connect to. I don't think there is another way to do it other than through your current GP now and say that this is an ongoing problem that needs rectifying. They can flag it up to the teams that are looking after the systems. That kind of thing wouldn't come through my team particularly. I think that's something that they... Right. Yeah, I agree. They should have done. Yeah. So let me catch you after this, and maybe I could take your information and go to practice and work with them to try and find what's happened there. I can try and resolve that to some degree. I can kind of speak to some people in the network and we can work that one out. Okay, thanks.
Yeah.
Well, I'll just. Sorry. Go on. Go ahead, sir.
For new subscribers, can the app use for new registrations, or you have to be on site to register?
So the new registrations with a general practice. So there is something called registration with a GP surgery service. I don't have that demo on here actually, but you can go to, when you go to the GP practice website and you select register with this GP, it should take you to an automatic form that you just fill in, and it should automatically go into the GP practice, and they will be able to get your record transferred if you were another GP. All of that is automated now. NHS England have done all of that work nationally. So that's a national thing. In Manchester, I think we're in the high 90% of conversion to that process. I think there's one or two have got an old kind of form to fill in, one or two general practices that have got an older form. We're in the high 90% of getting that automated. So when you fill it in, all that detail will be automatically pushed through and you'll be registered with that practice quite quickly. It should be straightforward, should be a link on the website, maybe I could connect with you after and just have a quick look and see which website your GP practice is using, and then we can help you with that. Yeah.
Cheers.
You're welcome. Okay, so I recognise some of these challenges and barriers and potentially frustrations, I'm sure, that you've had, and and I can empathise because I've had similar frustrations in many cases, and we've all got our own experiences of approaches to care, and how that feels when it comes back to us. It's not sometimes what we expect, and it's not always the outcome that we're looking for and things like that. But I just kind of wanted to get across today that there's 3 avenues to access that care to your GP practice. That's the main point. Using the NHS app, if anybody's got any specific challenges with the NHS app, I'm not sure if you're all smartphone users. That's why I gave the reassurance that phoning in and walking in are still ways of access. You must keep that in mind, because we've got relatives and things like that that definitely don't use. My aunt still uses checkbook and still writes checks for her bills and things. So I recognise not everybody's digitally enabled, but what digital does, it allows the spread of access for those that can. So it's not digital only, it's digital first. So there's some of the benefits. If you can read those, I'll move through this. There is some further details of registering for the app itself. I can leave a copy of this presentation with the team after, so if you really wanted to get into the weeds and spend the rest of your day reading this, you're more than welcome. But largely, I think if you're registering for the app, you'll see screenshots like this as you go through the step process. It is a little bit challenging because you've got to verify your identity, and that's a bit of a process. So you need some kind of government-issued identity document with your picture on it, and then you'll go through a phase of having an email as well, getting a secondary code to that email to make sure you're the person that's trying to register. So there's a few steps that you need to take, and it's not straightforward. So for those of you who are more digitally savvy, try and help, family members and relatives and things like that that are maybe struggling with that, because that's probably one of the hurdles that I've experienced in trying to get on the NHS app. If you're trying to connect the app to your particular GP surgery, you can request something called a linkage key. If you don't get through the normal process and connect into your practice, you can ask the practice directly for your linkage key. And it's 3 pieces of information, and you'll click through on the app, and you'll get to a point where you've got to put these 3 pieces of information in. One's the practice code itself, another's just a code number, and I can't think the third one might just be your name, something like that. But those 3 pieces of information need to be inserted into these key text box areas so that it will link you with your identity to your GP practice. So that hopefully connects you to your GP practice. Once you've got into that, you should be able to see your medical records to some degree. And this is prospective medical records, meaning forward-looking. So if you've got records from early 2000s, 1990s, whenever, that might not be there. It's from the day going forwards that you should see your records, so that you'll see any new appointments coming in, any new prescriptions reordered, things like that. You should see them going forwards from the date that you get on the app. So here it's going through the process. I'll probably do this kind of thing in a smaller workshop where we're sat in a bit more of an intimate circle, if you will, and I can sit next to you and work through the phone with you. But I'm happy to take any other questions as well around the apps and challenges that you might have had. Talked about the ID verification, that's fine. Again, smaller and intimate environment would probably go through this step by step. So if anybody's got any questions after this, I'm more than happy to hang about and just take those and have you get on the app if you really want to do that now. Just get through these. Sorry, they're just still similar screenshots to get you through. Another one is proxy access. So you can use the NHS app if you've got another family member that maybe doesn't use digital or isn't able to manage their own health independently. you can access their records through your app using proxy access. That means I can connect to a GP practice under my relative's account, if you will. So it just lets me go in that way and help manage their records. If they've got medications to reorder, I can do that on their behalf and help them get through their self-management of medical stuff that they need. Again, it's all within the app itself, so without actually being side by side and working through it, I wouldn't understand the challenge you've personally got with the app itself. But if you wanted to share any of those with me, I'm more than welcome to take them and questions. But yeah, so there's more of an intimate type of presentation, that one. But I hope that you feel safe enough and comfortable enough to ask anything you want. It might be recorded for you, but the only things I will take back are directly to NHS England with NHS app challenges as an ambassador, and I'll try and reach out to GP practices across Manchester. I understand you might not all be closely local here. You might have travelled in from further in other parts of Manchester. I cover all of Greater Manchester, so I can speak to the 406 general practices there are across Manchester to help you out. So I hope that works for you for today. If there's any questions, I'm happy to continue.
Can we appreciate our facilitator? You can do better than that. Let's appreciate him. Thank you very much. Yeah, so now we want to take our questions. Like he said, he's in a good position to let the NHS England know some of the frustrations we have with navigating the NHS app and all the other challenges that may come along with it. Please be sincere enough to ask your questions. Let him have a true picture of what exactly the situation is, so that it can also make the reporting back very easy for him to do. So we start with Dad Moyo. Who else again has a question? Clarification? Any other person with a question or clarification? Any other person? Okay, let's start with him. I know when he starts talking, some other persons might remember the course of the conversation and come up with a question. Yes.
I have your 2 years old son. He's having the flu, and I got a message that from 2 to 3 years we should contact GP for vaccination. And last week, I say 2 weeks ago, I contacted GP, and GP told me, sorry, we have not gotten any vaccine, that you will be contacted later, right? And in that situation, my son is having flu, coughing, nose running,
I understand.
So what is the best thing to do? Should I be looking at him like that?
No, not at all. And the GP may have been able to redirect you to the pharmacy. Any pharmacy that's offering vaccinations would have been another access point for you to consider, or at least just get advice. If the GP is not giving you the immediate solution right away, there are other avenues you can try. So you can go to the pharmacy and say, my child is unwell. What's your advice? Do you have vaccinations here? Because immediate flu, the vaccination's not going to do anything for that. It's for prevention later on, isn't it? So the vaccination might have been an option to go to the pharmacy because they might offer that service. It's just checking with the local pharmacy as an option. Regular flu management, you say your child is 2 or something, so whatever is recommended, you get the advice from the pharmacy on the kind of medications you could probably use. Maybe something like a soft paracetamol, Calpol, or something like that, the common brand that's used for young children. In that circumstance, to try and lower the temperature and make them feel a bit better. Something more serious, you can call treble 1. Even more serious, if it's urgent, emergency, definitely just call 999. And they're a very fast response when it's children. It's usually fast response, and you'll be straight in. That's my experience anyway. But I hope that kind of covers some of what your question was. So are you happy with that answer? Yeah, you feel okay? Yeah. All right.
Thank you for this opportunity. First thing, I would like to commend my GP, Brenington GP. People have complained about their GP here and there. Just, I want to commend them. They've been so good. Currently, I book GP appointment through the phone call, and even in a days, I can get appointment. Just the same day that I call them. So Brenington GP, I commend them for that. So my question is this: now with this app, I just downloaded it, so I've not completed the registration because of the ID and all that. So I was just wondering, with the kids, are we going to use them under the PROSI registration, or is there provision for to add the kids to the?
Yeah, there is. You can do that through proxy access again. You have to speak to the GP practice directly so that they can do it on the system side. And then once they activate it on the system, then you will see that option come up in your phone as a proxy, add child to your account, and you should be able to access their records and see all their vaccinations and things like that. Yeah, so you should, yeah. So definitely, once you've got onto the app and you've got your ID verification sorted and you're connected to the GP practice, I'd speak to the GP practice directly and then ask for proxy access for your children. Yeah.
Great.
Okay.
Do we have any other question?
Yes, sir.
Yeah.
Go ahead.
I want to ask, is it possible for a visitor, that someone on the visit visa, to access the NHS?
So you're on a visit visa to
Yeah.
access the NHS.
Maybe
Yes.
like if dad or your family member traveled down from abroad and staying with him and might need to use
The
GP or
NHS
something.
or the GP?
So I imagine there is access available. I mean, there's not, it's not as if you just have to pay for it. I think that's all it would be. It would be a payment situation. If you declare that, I'm on a visit visa, I really need some support. But it's depending what kind of support you need. You might find other ways to access self-help.
Yeah.
You might use the pharmacy. Anything over the counter is fairly simple. If it's simple, basic stuff, you might have a better route to access through the open source of services available. But if you actually need a GP specifically, which is not that often really, you don't really need a GP many times. There's very few times, unless it's reassurance and you're going to be okay kind of thing. And you need a referral, that's a different story. But if you've got a situation where you might need a referral, then you might actually have another situation where you're better off just going to the hospital, if that's that serious. GP is not an urgent service in that sense. It's not an emergency service, should I say. It is for, general unwellness and medication management largely, and a host of other services, because I don't want to kind of play down what they do because they do a lot. It's just that I think we overuse the GP for unnecessary things. So yes, I imagine there is access, but it might just be a paid situation specifically for that. I know there's the other kind of visas that people are here on, and they have to pay an annual fee to the NHS for health services anyway. So yeah, does that answer that?
Thank you.
Okay, you're welcome.
Do we have any other question?
Yeah, go ahead. Yeah, go ahead. Just the lady at the back there.
Good afternoon. You said the thing is people are using the GP service for unnecessary stuff. In a way, I kind of see it like GP being the first point of care for us anyways. If we have an issue or health concern and we wouldn't know if it's necessary or unnecessary, as you said.
I understand.
But however, to the patient or to the person needing the care, it is very essential, right? And if we're not able to get that service from the GP, what's going to happen is there's going to be a knock-on effect to A&E. Because when people are not able to receive what the care they need in the primary care, they're going to turn to going to A&E, and that is what happens now with A&E being over-flooded.
people are turning on to A&E for things that are not important. So I think the issue is there isn't enough GP. And I think the system needs to be not running efficiently at this time, looking after the multitudes, the amount of the population. And rather than looking at the concerns of the patient as not necessary, I think instead they should be looking at devising solutions. So in a way, I'm kind of happy that this week they did announce about the telehealth where you can book the appointments online. But in your opinion, do you think that's going to fix the problem? Or do you think that's just shifting the problem?
That's a good question. And thank you for raising that. I think it's important for us to at least understand those routes of access that are available. And yes, let the professionals decide what is considered important so they can triage properly. You'll have heard triage maybe where they redirect your question or your concern or your ailment to the right person. It might be a nurse within the practice, it might be a physio within the practice. It will be directed as such in the nature of what you describe on your consultation form or your description over the phone. So yes, you're right. In terms of what's important, yes, it is important for us. I'm a patient too, so it is important for me. But yeah, I have to let the professionals decide where my attention gets put to and the right service at the right time. And that does kind of take some of the load off the GPs directly. And maybe I could have been a bit wiser with my choice of words earlier in terms of what's important. I think, yes, our troubles are important. It's just that it's not that they're graded differently either. It's just that there's better routes to service. I think that's what I was really trying to say, and I was a bit careless earlier, so I apologise for that. But I think, yeah, there are better routes to services for certain things. And it's just how do we separate all of that quickly enough so that you receive the service that you need and others that actually do need a GP for something can get there. And that's all it's about. So we're trying to spread the way of access into the GP because you kind of got this funnel coming in and then the funnel gets smaller at one side, doesn't it? And that smaller side is the GP practice itself because they don't have thousands of staff. They've got a limited number of GPs, many work part-time, a limited number of nurses, physios, admin team, and it's really challenging. And you've got a volume of inquiry, not just clinical inquiry, but administrative inquiry, because you might be actually applying for personal independent allowance, for example, and you need access to your records. But now with the NHS app, you should be able to see your records through the app. And that will help you fill in your forms, fill in any details. You don't need to keep asking your GP, pay £10 for the letter and get them to look. Save so much. So I recognise what you see, and I recognise that we have yet to see the benefit of the implementation of all of this digital way forward. But it will come. And some people are feeling those benefits already early. But yet the broader benefit isn't quite widely felt just yet. So I understand you might feel a little sceptical and the question's still in the air. But I'm hearing the narrative of positive stories of access and how we're treated. I had at least 2 or 3 stories today, that kind of balance out that negative and positive dynamic. So I'm quite optimistic at that, in that, it's not the case every time that it's a negative experience for everyone. I think we all have different experiences, but I do take your point. It's very important. Thank you.
Okay. Do we still have any other question? Anybody willing to ask anything again? Okay. My concern majorly, is the waiting lines could be waiting times, being on the waiting list forever, For many of us, we come from countries that you don't really have to be on the waiting list for that long. I mean, if you have an issue and you need to be operated on, maximum, maybe 3 days. You get that sorted out of the way. Of course, you've got to pay for it, but you don't mind. You pay for it and you get the service that we wanted to our taste. But now coming here that if you have issues and you've got to be on waiting list, I used to work with NHS and I've seen people being on waiting list for 65 weeks. It's I know it might be beyond you what I'm trying to ask, but where are we really getting with these waiting lists? Because there are some cases of some of people of color that they have to travel back to their country, most times to Nigeria, and they get what they've been on waiting list for weeks. They get it done within that same week that they get back to their home country, and they recuperate and fly back to the UK. So where are we really getting with these waiting lists?
It's a good question, and I think there's a lot of reorganisation of services to streamline the approach to tackling waiting lists. Some of the service redesign that's going on in the background, it does take a little bit of time to kind of get right. So that, yes, I recognise that we've had this influx of waiting list growth, if you will. But I do believe that they are working through those waiting lists with absolute diligence and care so that every individual who is seen at the highest level of quality that they can be given at that particular time. So yes, there's a need to get through the waiting list quickly, but they'll never compromise on safety and quality care. I think that there's a bigger repercussion if they get careless when it comes to pushing through the system. So it's a tough one. Yeah.
Sure, I know. All right. Okay.
Thank you. Please, I have a question. Concerning the emergency. When you go to AI, why is it that you have to stay like 10 hours, 12 hours before you have been attended to? Because something we call an emergency, I think it's something that should like take a drastic. So, but why is that? No, there was a day I took my daughter to emergency. She was vomiting. She felt so sick that she couldn't even retain anything. And getting there, we were asked to sit down, and we sat down over the night. She was throwing up to the extent that she couldn't sit up again. I had to put my clothes on the floor for her to lie on. It was until when they saw that, they now asked us to get a bed for her to stay. And this is not the first experience. It's been like that. When you even feel like you are sick or you're having, when you call GP for certain things, they will tell you have to go to A&E. And when you think about what you will meet at A&E, you will decide not to even go. Like, you're having chest pain. If you tell your GP you're having chest pain, back pain, and everything at the same time like that, they will tell you go to A&E. Getting to A&E, you just discover that you're just sitting down there in that pain. Nobody is attending to you. You are spending hours there. There is nothing to be done. Do you understand what I mean? And, this thing has happened to a friend of mine in Wales, that the lady eventually died. She slumped and died right there. So why waiting to see the doctor? What do we do about that?
And I'm sorry to hear about that reference to your friend there who passed away, obviously. And that is a difficult situation. Generally, A&E, you are triaged as fairly quickly as they can do to see how they categorize the priority. So, if you think about ABC, airway, breathing, circulation, that kind of thing, that, are you breathing is the first question usually. So that kind of prioritizes you. And then so on and so forth down the list in that sense. So it might look like a bit of chaos in A&E, but they've got a particular system that they're following to try and prioritize the right people and doing their best, absolute best, to get the right people the right care that they need quickly. It is frustrating that we're there for between 6 to 10 hours. I've faced it too. And I actually know people in A&E as well, and that doesn't get me through any quicker. So I recognise that it is frustrating waiting. And it's just understanding, what might be distressing to watch and feel as a parent or as the individual. In the medical world, they look at it in that way, that, are you breathing, and so on, and then they work from that. So, if you've got pain, that's something that they can work around and manage and help you with that. So there's certain things that they can do to kind of ease your situation and make you feel more comfortable, until they get time to investigate the problem properly and thoroughly, so that you get the right care. Because that's the challenge, is doing things quickly and doing things properly. And they're trying to balance those two, and more than that as well. So I'm sorry for your experience there personally, and I hear it today. Thank you. It's important we talk about these things as well openly. I can't give you all the answers necessarily. It's going to be perfect, but I hope it goes some way to giving you some reassurance of why things they are the way they are.
Let's appreciate our facilitator. Come on, you can do better than that. Let's appreciate him. Thank you so much, Jeremy, for coming. So, Jeremy is just a digital hub ambassador. He might not be in the best position to answer all these GP and all these waiting line questions. It's like we are bombarding him with things that is out of his own scope or out of his own job description. But this month, we're still going to have another doctor that is going to come and we'll be able to attend to all these issues as regards treatments and assessing the quality of care that we think we deserve to have at the NHS. So once again, let's appreciate Jeremy and his lovely, lovely wife that is here to support. Thank you so very much for coming. We deeply appreciate your coming for this seminar this afternoon. So thank you everyone. So we've been in church since like 11 o'clock, so we should be winding down now so that we go enjoy the rest of our Sunday. Thankfully, in the course of your presentation, our lead pastor walked in. He was out of town. He was coming from Blackpool. Person of Pastor Peter Adejumo, here is he. So he's joined us here. So next week, we're still going to have another session to look at another aspect of healthcare in the UK, and want to encourage all of us to be part of it. Thank you very much for waiting, and thank you once again to our facilitator. Thank you. Thank you. So see you. Do enjoy your week. Thank you, everyone. Yeah, we just have a group picture. Pastor, please come. Let's have a group picture.